Thank you, President Officer. The 3 code blacks issued by our hospitals in the last week means long-awaited operations have been cancelled. GP appointments are also off, pharmacies closed, waste not collected, and social care impacted too. It's in large part because thousands of key workers are self-isolating, even though they have tested negative. I support the call from the Royal Colleges for a test and release system so these people can return to work. Is this being considered? And if so, when could it be in place? Because the situation is urgent now. And probably for the last time as Liberal Democrat leader, can I ask the First Minister what she's got to say to the thousands of adults with special needs and their families? They have been without services since the pandemic started and are desperate for support and respite. When can they expect full services to return?
First Minister.
Thanks, and let me take the opportunity to wish Willie Rennie all the best in his retirement, not from Parliament obviously, or from public life, but as leader of the Scottish Liberal Democrats. I think 10 years is a good shift that he's put in there, and I'm sure we all wish him well. I'll come to the second question first, if I may. What we have confirmed today is, I think, very positive in terms of getting services for adults with disabilities back to much greater normality. As I've set out before, it's not been the case that these services have been compulsorily closed, but because of 2 metres physical distancing, there has been a practical difficulty on the part of operators in opening them up as normal. So the move from 2 metres to 1 metre physical distancing indoors should pave the way to much greater normality, and I know that will be welcome and bring much needed relief to many in that category. In terms of the first question, I should say in passing that when health boards or individual hospitals within health boards are announcing the pausing of elective non-COVID treatment, we want that to be for as short a period of time as possible. So that's not something that is going to happen and then we just accept that for a long period of time. This is something that is kept dynamically under review, and we want to minimise that as much as possible. There is a great emphasis right now on trying to get the NHS back to normal and the backlog of non-COVID care well underway in being addressed.